The replacement for Obamacare, recently passed by the U.S. House of Representatives, will face a challenge in the Senate, but there's still concern well beyond Washington about how a change in the landscape for health care will affect people throughout the country, not to mention their state budgets. With a look at the possible consequences for Massachusetts is our guest from Healthcare for All, the Associate Director of Policy and Government Relations, Suzanne Curry. Thank you very much for being with us, Suzanne.
Thanks for having me here.
Well, one thing that's changed since you were last with us and since this measure was passed in the House of Representatives and Congress is that there's a new analysis of what that version in the House would mean for Massachusetts. So what do we know now?
Well, it's all bad news, unfortunately. At the very least, people will lose coverage, and even worst case scenario, more people will lose coverage. So we know that up to about 445,000 Massachusetts residents will lose coverage under the health care bill that was passed by the House of Representatives. And that would bring our uninsurance rate up to about 10%. We're about 3% right now in the state. And that would bring us back a couple of steps. It would bring us back over a decade of work that we've tried to reform the system. So it would bring us back to even before where we were in 2006 with the Chapter 58 in Romneycare.
So who are the people most likely to lose their coverage?
Mostly people who are getting assistance with their health coverage. So a couple of things that the House of Representatives bill does is, one, it removes the subsidies for cost sharing reductions. So when you go to the doctor, you pay less in a deductible or a copay. And it also gets rid of the help for assistance with premiums, and it change it to an age-based tax credit as opposed to a tax credit based on need. And so that program would likely be decimated under the House bill. The second thing it does is it really takes a toll on state budgets with regards to our Medicaid programs, for both the Medicaid expansion program, so that is for people who are adults who are low income, who don't have kids, but then also it just changes the formula for funding for states to get Medicaid funding from the federal government, and that would mean that a lot of folks on our mass health program would see a lot of unintended consequences from this.
My first guess is that the people who benefited from the Medicaid expansion would be hit the hardest, since the people who are still poverty level, who have children or maybe disabilities, there would still be some Medicaid for them, wouldn't there?
Yes, I mean, in our state we have a great commitment to having coverage for all our residents, and I think that commitment will continue. However, we're going to do it with a lot less money. So there may be some difficult decisions that need to be made about to the extent of how much coverage people get, so maybe some changes in benefits, and we need to look at, can we raise new revenues in the state to make sure that all our people are covered, or are we going to have to cut back on eligibility and benefits and cut back our rates that we pay our providers.
Now, Medicaid also covers extended care for elderly people. What about that? Anything we can think about how that might be affected?
Right. So the Urban Institute analysis did not look at the home and community-based services that we think of when we think of long-term care. But again, Medicaid, the funding is coming into the state at a much reduced rate, and so it really kind of depends on what the state makes as far as its decisions about what they're going to cover and what they're not going to cover at the end of the day, based on the new funding that's coming in from the federal government. So certainly seniors who are receiving long-term care through Mass Health could be at risk for not getting those services.
This is BNN News, and we're talking with Suzanne Curry from Healthcare for All. Suzanne, when I go back to one of the rationales for the Republican replacement bill is that they're supposed to reduce the cost of market rate insurance for a lot of people, maybe not everybody, but wouldn't that soak up some of the people being left uninsured?
Well, you would hope, except part of what the bill does is they get rid of those subsidies that help you pay for the health insurance. So that would raise your premiums and cost sharing already. And the other thing that it does is that, insurers are not really sure. There's a lot of uncertainty in the market right now, right? And so there's uncertainty also about whether the current presidential administration is going to continue to pay some of the reductions in those cost-sharing subsidies. And so that's causing instability in the market, and they may raise premiums to make up for those the loss in the cost-sharing subsidies. So that is something that can really impact people's ability to purchase coverage.
I'm imagining that a young person who's fairly healthy might find there's a plan out there that's okay. It's very minimal maybe, but it's relatively cheap. But what about someone who's not so young and not so healthy? What about their...
They'll get hit hard. Part of the other thing the House bill does is it allows states to change the way, in the Affordable Care Act, we had a lot of protections for people. You couldn't deny them coverage based on pre-existing conditions, which could be everything, from asthma to cancer. And you also couldn't charge them more based on those pre-existing conditions. And a lot of what this House bill does is give the states the opportunity to change that back to the way it was and increase costs for people who may be older and who have pre-existing conditions.
Yeah, change that out a little bit more, because especially when you said asthma, the pre-existing conditions, this is not just about the middle-aged person with high blood pressure. I mean, this could be the kid.
It could be the kid, and we've heard Jimmy Kimmel's story about his son being born with a heart condition, which happens, more often than we'd like to think. It could be, there's also kind of what they call age rating. Could be by virtue of just being older, they can charge you more and more. So there's a lot of different things that could happen, and the insurance companies kind of have more of the they can kind of make up what they see as a pre-existing condition and charge someone more based on that.
Okay. What about some of the other things that are going on? I mean the Republicans, they're talking about, wouldn't it be nice to let states do things like have workfare requirements for people getting health care, or drug testing or something. I mean, is there any redeeming angle to any of that you could see?
Not from how we see it. I think, most of the people who are on our Mass Health program in Massachusetts who are able to work do so, and that's the case for people in Medicaid programs across the country. The Commonwealth Fund recently did a study on this around work requirements and do they work, and what they found is it's more of an administrative burden than would actually kind of give costs back to the state. And so we just don't think it's a good investment, and we don't think it's a way to treat people. And we also at Healthcare for All see healthcare as a human right, and so we don't think that you should have to get a job before you can get health care.
One of the other possibilities here is that we could go back to what we had in many states before Obamacare, and that would be high-risk pools for people with pre-existing conditions. What do we know about how those pools have worked?
They haven't worked very well in the past, and largely because they've been underfunded. So there is some funding in the House bill that has been passed that the Senate will consider around high-risk pools. They're multi-billion dollars coming from the federal government, which is still not enough to cover the costs for people who have high needs, and then leaves them in a lurch and leaves them either not getting care or incurring medical debt and other high bills because they need the care and they can't pay for it.
Of course, now what many people are saying, that now that this bill passed by the House has landed in the Senate, they expect that not only will the Democrats have a problem with it, but a lot of Republican senators, and of course they have even some Republican governors like our Charlie Baker who has a problem with it too.
Right.
So, maybe whatever comes out of the Senate isn't going to be anything like this House bill at all, maybe.
It remains to be seen. We really don't know what the Senate is doing right now with regards to the language and what's going to be included in the final bill. We know that they are having conversations in the Senate among all different constituencies and different political parties to try to get the votes that they need to get something through. So, when we do see something, we will definitely be here again to analyze and let you know kind of what the impact would be for Massachusetts. But, there may be some things that they can't agree on and they do not move forward with in the House bill. But whatever they do move forward with, if it is going to take a lot of what is in the House bill, it's still going to be a pretty horrible bill for people in Massachusetts and across the country.
Thank you very much for being with us.
Thank you.
Suzanne Curry from Healthcare for All. And we'll have more news in just a moment.